The sneezing.
Sneezing, runny nose, itchy nose.
The wheezing.
I see that he gets winded faster than most of the other children.
You feel terrible, but what causes it? And what can you do about it? It's time to take control of your asthma and allergies.
Asthma and Allergies. Take Control, a KARK special presentation, sponsored by Little Rock Allergy and Asthma Clinic.
Hi, I'm Tracy Douglas. Over the next half hour, we're going to talk about two conditions that affect millions of Americans, allergies and asthma. It's estimated that 1 out of every 4 Americans has one or both of these conditions, and the numbers are growing. Before we talk about diagnosing and treating these conditions, let's first understand what causes them, starting with allergies. An allergy is the body's abnormal reaction to a normally harmless substance. When an allergen like pollen is absorbed into the body of an allergic person, the immune system views it as an invader. The immune system then produces an allergy antibody, which attaches itself to special cells called mast cells. This causes the body to release histamine, a chemical that causes allergy symptoms. Joining me now is Dr. Jim Ingram from Little Rock Allergy and Asthma Clinic. Dr. Ingram, a lot of folks talk about allergy season, but is there really a specific allergy season?
The answer is yes. We all have things in our house, Tracy, that cause allergies year-round, like dust mites and our cats and dogs. But there is a definite allergy season for different pollens and molds and things outdoors.
All right, trees, March through May?
Yeah, trees are the first thing that cause people allergies and that really tip people over the edge with their allergy problems. And then the grasses follow soon after the trees do. And then later on in the fall, you have more of the ragweed and the other weeds in August and September and on into October. And then all throughout, anytime it's warm, you're going to have mold outdoors, and so the mold level goes up and down with weather changes and things like that.
All right, every year the Allergy and Asthma Foundation of America releases the top 100 allergy capitals in the United States, and this year Little Rock ranks as number 9, but I understand that we used to be number 2 or 3?
Yeah, a few years ago it was ranked number 2 in the nation, and allergies this year number 9, still very high. We have, being a more rural state, I think that helps part of it. We have more trees, more grass per capita, so to speak, and so Little Rock is usually right up there every year. You can find things anywhere in the country. You know, some people say, I'm going to move to Arizona.
Exactly.
But you can find things to be, if you're an allergic person, you can find things in any environment to be allergic to. And there are different seasons of these allergies in different parts of the country. We have, because we're so warm here, we have longer growing seasons. There's more pollen season because the trees and the grasses and the weeds have longer to grow and to pollinate. In Florida, it's even worse. It's pretty much year-round in places like Florida, but here it's still very long.
So what do people suffer with the most as far as the trees and the seasons?
Well, I think people that are allergic to trees and grasses tend to feel it more than other people because they go from being around nothing they're allergic to, you know, in February, to all of a sudden in March they've got this huge pollen load that they kind of going from a car going from 0 to 60 in 3 seconds. You do that with your allergies. You nothing to be allergic to a bunch, and so people get tipped over with their allergies very quickly in March and then in April with the grass coming on later. So.
Okay. Well, Dr. Ingram, thank you very much.
Thanks, Tracy.
Little Rock Allergy and Asthma Clinic is the only certified organization in Central Arkansas to do on-site pollen counting. Let's take a look at how they do it and what this means for allergy sufferers. Counting pollen means climbing a ladder at Little Rock Allergy and Asthma Clinic. That's because the pollen and spore trap, nicknamed Dorothy, is located high atop this building. Here's how it works.
The wind is sucked with a vacuum cleaner-like device in at a constant rate, and the pollen is deposited on a greased slide.
Once a day, clinic employees remove the slide. Then it's down to the lab where they stain the slide and count the pollen grains using a microscope. The numbers are then posted on the clinic's website.
So what we do is we post the count, but we also post an interpretation because it's different for each of the pollens. For example, the tree pollen is different than the grass pollen. So on our website, we always post whether it's low, moderate, high, or very high.
You can find the daily pollen count by logging on to littlerockallergy.com. Look for the pollen count link on the homepage. Coming up, is it allergies or cold? How can you tell the difference? We'll have some sure signs. Plus, how do doctors figure out what's making you sneeze and wheeze? We'll take you inside an allergy evaluation.
In our clinic, we recommend allergy skin testing as the primary mode for testing for allergies. The reason we do that is it's the most specific and sensitive test that's available at this time, even more so than any blood test that's available.
Many people may not realize that they have allergies, often thinking it's just a cold. So, how can you tell the difference? Well, symptoms of allergies include a runny or stuffy nose, sneezing, and watery, itchy eyes. A cold may include all of those symptoms, plus fever, aches, and pains. With allergies, symptoms begin almost immediately after exposure to an allergen, while it usually takes a few days for a cold to hit full force. Welcome back. So once you think you may have allergies, the next step is usually to schedule an appointment with a doctor. Let's see what it takes for an allergist to figure out what's making you sneeze. 4-year-old Mitchell Keenan has suffered from allergies his entire short life.
I remember actually the day he was born, he sounded congested.
His mom says allergies have impacted everything from school to sleep.
He loves sports, and I see that he gets winded faster than most of the other children. I also think he doesn't sleep well at night.
Mitchell's on 3 medications for his allergies right now. Too many, according to his mom. So she took him to Little Rock Allergy and Asthma Clinic to talk about a possible change in treatment.
Hello.
First, the consultation. Dr. Deanna Ruddle asks about things like medical history, symptoms, and home environment. A family history of allergies is also something to consider.
Allergies are very hereditary. When one parent has allergies, up to 50, there's a 50% chance for the child to also have allergies.
After an exam, it's time for the diagnostic testing. Mitchell's breathing levels are checked, and then an allergy test is done with a multi-test device. It's a technique of applying suspected allergens directly to the skin with a skin prick device. One prick represents each allergen he's been tested for.
What we're looking for with our testing would be redness and swelling, so we can specifically tell which or what he's allergic to, and then decide what treatment will be most helpful for Mitchell.
Some allergy problems can be complex, so you should plan to be at the clinic for 2 or 3 hours. By the way, Mitchell is now on new medication. His mom says it has stopped his coughing, and he's now able to keep up with the other kids a little bit better. Still to come, we'll turn our focus to asthma, its causes and treatment, and we'll tell you about a free summer camp for kids with asthma, including how to sign your kids up.
Hay fever, which is also known as allergic rhinitis, is a very common problem in a large proportion of our patients. Many patients are looking for treatments and potential cures. The one cure we can offer are immunotherapy injections, or otherwise known as allergy shots. Most patients can take these shots for approximately 4 to 5 years, and sometimes up to 80% of these patients can have a cure for their allergies.